If you're planning to become pregnant, taking certain steps can help reduce risks to both you and your baby. Joining us to explain the steps you can take to prepare for pregnancy is Toro family medicine physician Dr. Meredith Maxwell. Hi, Dr. Maxwell.
Hi, how are you?
I'm good, thank you. All right, so, if you are trying to actively get pregnant, what should you do maybe before you take those steps to make sure your body is in tip-top shape?
So the preconception exam before you get pregnant is going to be very important for guidance. Going into your doctor, telling them about your family history, screening about whether you need early genetic testing is going to be important. If you have pre-existing things like seizures or diabetes or high blood pressure, anemia, those can really affect your pregnancy. So we like to kind of get special hold on those before pregnancy happens. And then vaccines are important. Most vaccines you cannot get while you're pregnant. So sometimes in certain situations, we like to check and make sure that you're up to date and you have immunity against certain things before you get pregnant, because it can be damaging to the baby if you do get these illnesses during pregnancy. So we like to try to kind of protect you before you get
Sure.
pregnant.
And some people don't even know that they're pregnant. Let's say they're not actively trying. They may not realize they're pregnant for several months. So if they do have one of these pre-existing conditions that can be dangerous to a baby, that's why it's even more important to kind of get a handle on that before you're actually pregnant.
Exactly. And, I always tell my patients, if you're not actively preventing, then you need to probably be taking these steps just in case something does happen. So, some important things to do would be like quit smoking, make sure you're a good weight, make sure that you're taking like a folic acid and a prenatal to prevent birth defects is a really important thing. There's certain things that you should not touch if you're not actively preventing or trying to become pregnant, like lead and pesticides and kitty litter. Those are big no-nos. So, if you're not actively trying and not actively preventing, I would probably take these steps.
Yeah, taking a prenatal vitamin, I think a lot of people don't realize that that's a good thing to do when you are just trying to get pregnant.
Exactly. It can prevent birth defects. Baby needs special vitamins that you might not necessarily have while you're trying to conceive. So there's kind of boosters that we recommend to help baby during pregnancy.
I want to ask you about this because I think this is timely. We've heard people say, oh, I don't know if I want to get the COVID vaccine because I'm trying to get pregnant. Can you
Right.
explain, is it safe to get the COVID vaccine if you're trying to get pregnant, if you are pregnant?
So I think different providers are saying different things, and it really depends how your pregnancy is going and if you're having difficulty or not. So that's one caveat. I've seen people that are going through IVF have different situations, but what I am telling people is if you are trying to become pregnant or planning to become pregnant, I would probably plan on getting the vaccine before pregnancy because it is so dangerous if you contract COVID during pregnancy, more so than if you were not pregnant. So that's another thing that you want to think about. You want to talk to your provider about your special circumstances and how you should time things. I am definitely a proponent of getting it.
All right, Dr. Maxwell, thank you so much for your time this morning.
Of course.
Let's get over to Shelby now with the check on your forecast.